Cutting back on addiction by keeping unneeded painkillers off the streets. Tonight, we learned from the largest healthcare provider in the Intermountain West on how they've cut back on prescribing post-surgery opioids by 3.8 million pills just last year. 6 on Your Side's Lehr went to Salt Lake City to see how their physicians are using science to back their movement. She joins us live in studio in tonight's Finding Hope.
Well, Don, not only are doctors with Intermountain Healthcare sending patients home with much fewer pain pills than in the past, but they're also taking major strides toward educating every person that walks through their doors about the potential addictive side effects of many medications.
78 to 80% of current heroin users started with prescription pain medication.
That's motivation enough for Dr. Jay Bishop and the rest of Utah's Intermountain Healthcare system to step up and take action in efforts to prevent playing a part in increased opioid addiction among their patients.
But what we found is we can prescribe at least 50% less than we are currently prescribing.
In 2017, Intermountain started a database compiling information from 170,000 patients post-surgery.
Hysterectomy, eye surgery, kidney stones, broken arms, knee replacements.
Their main areas of focus: was your pain adequately controlled, and did you take home more prescription painkillers than you needed? The results are eye-opening for physicians.
To say, look, you've been giving 30 Percocet tablets to patients who've had kidney stones. They're going to take on average 4. Wow. And in urology, it turns out the sweet spot is right around 10 tablets, no matter what we do to you, about 10. For other surgeries, a little more invasive, it's about 12 to 15. But it's not these high numbers, 60, 30, that we used to prescribe. It's far less than that.
They even take into account whether or not the patient has a higher tolerance for opioids, depending on medications for other conditions.
The physicians can go into the electronic medical record and say, okay, I just did a knee replacement on somebody who's taking narcotics coming into surgery. What's the average number that they consume?
Intermountain's physicians then typically send home 2 prescriptions, one to manage pain in the immediate days following surgery, and a second dated prescription that can't be filled until a week later.
So that just in case they need it, they have it.
Since the start of the Share database, a major cutback on the number of unneeded pills sent home.
And having done that across the system, we've decreased opioid prescriptions by 24%.
Tallying up to the equivalent of 3.8 million pills in just 1 year.
It's a lot of pills that weren't going to be used for good reasons.
They've also implemented a program called Speak Out, Opt Out, Throw Out, educating patients they don't need to take opioids if they don't want to.
Patients will now say, do I really need to take these? I'm going to take the prescription. I'm not going to fill it unless I need it.
The healthcare system has also helped fund billboards around town, along with increasing signage within the hospital itself, educating patients about the addictive aspects of many medications.
Now, here in Utah, the key to reducing opioid prescriptions isn't just relying on the physicians, it's also educating the patients themselves, using signs like this to get the conversation started.
And we've put wraps all over in the hospital, like in the surgery waiting area where your family's waiting for you to come out of surgery. We have literature in there. We have wraps that show the dangers of opioids. So by the time you come out of surgery and are ready for discharge, we've hit you and your family to say, hey, look, these can be very dangerous substances.
So it's pretty remarkable how much progress they've made in just a year. They're also sending home all of these surgery patients home with informational cards about the importance of getting rid of those extra pills after they're done with their healing process. So as part of Speak Out, Opt Out, Throw Out, they've also increased the number of drug take-back bins at each of their hospitals and in their pharmacies.
It is so refreshing to hear a physician talk about the pill count.
Yeah, and they're even sending some patients home just by using Tylenol and Motrin at the hospital. So people are learning, especially since they're getting this conversation started. They know that there are some ways to treat this pain that are not through opioids. And again, it's worth mentioning this has nothing to do with chronic pain patients. This is just for acute pain for people after surgeries or after some type of medical procedures where that pain is only going to last for a short period of time, because Dr. Bishop says the two are incredibly different.
Yeah, well, thanks for that report.
Acute pain is something that we expect to go away. Chronic pain is something that is a chronic disease like diabetes or back pain or high blood pressure that needs constant management until the pain either goes away, and in some it never does go away, so it needs constant management.
Now, as part of their research, many chronic pain physicians with Intermountain Healthcare have also been exploring alternative treatments to help their patients, finding great success so far with some things like movement therapy and anti-inflammatory steroids.